American Heart Month is quickly approaching as it's almost February. And over on the east side, Overlake Medical Center's Heart and Vascular Center, in partnership with Evergreen Healthcare and Kaiser Permanente, offers a full range of resources for the prevention and treatment of heart and vascular diseases. And here to tell us more is Overlake cardiologist, Dr. Ron Aviles. Thank you so much for being here.
Thank you for having me.
Yes, and so before we start, what does the Heart and Vascular Center at Overlake offer?
So the Heart and Vascular Center, one of the major programs that we have within it is the structural heart program. And the structural heart program aims to treat diseases of the structure of the heart, and that includes diseases like aortic stenosis, like mitral regurgitation, like congenital heart anomalies, so what people call holes in the heart, atrial septal defect, patent foramen ovale, and one of the other diseases that we treat is has to do with stroke prevention. There's an outpouching in the left upper chamber of the heart that we can seal off to prevent stroke in patients that have atrial fibrillation.
Wow, incredible. And what are some of the treatments and services that are offered for the structural heart conditions like we talked about, like some of the valve procedures?
So we have the full range of treatment options that include open heart surgery, which is the traditional surgery, to minimal invasive surgery like repairs of the aortic valve, like the Ozaki procedure. We have minimal invasive techniques to treat these conditions that are catheter-based, like the transcatheter aortic valve replacement procedure, mitral edge-to-edge repair techniques, and then a procedure called the left atrial appendage occlusion device procedure that helps to seal off that outpouching of the heart to prevent stroke in patients with atrial fibrillation.
And do you have to cardiac implant closures? Is that what you're talking about there, or what is that?
So all these techniques that are minimally invasive are catheter-based. So you're going to be approaching the heart from a vessel away from the heart. And yes, they get from that location all the way to the heart to either implant, devices or repair, with devices, either the heart valves or plugging these outpouchings that are sources of stroke.
Pretty incredible to have these different, treatments instead of just, like you said, the open heart surgery as the only option, right?
There's been an explosion of innovation in this field over the last 10 years, that has brought in cardiac surgeons and interventional cardiologists and structural cardiologists like I am to really move the field forward to make it less invasive for people to have these treatment options. And what that does is to expand the population that we can treat and to minimize the recovery and the impact on patients. And
I was going to ask, what's the benefit, but it's not as big of a recovery. Is that what you're saying?
The recovery is night and day. You think about the traditional open heart surgery where the chest is opened and, people have to recover over 6 to 12 weeks, and when you have a catheter-based procedure, recovery is overnight, and within a week, you're back to doing what you do. So it's a really move forward in the care of patients with structural heart disease.
Definitely. And why choose Overlake Heart and Vascular Center for your heart needs?
So the reason anybody should choose anything is because of the track record. What are your outcomes?
Definitely.
And that should be reason number 1 through 10. And one of the things that we have done at Overlake Hospital over the last 10 years, implementing this program, is to have great outcomes. We are top 7% in the nation as far as important outcomes are concerned, like survival, like stroke prevention, like use of pacemakers and valve function. That should be what people are looking at first and foremost. But we also need to feel that we're cared for when we're there. So culture is important. Having a culture of compassionate care and excellence. The people involved are a key for that culture. So having well-trained people that have lots of experience, and if that isn't enough, then location is really important. It's a premier cardiovascular comprehensive center right on the east side in your backyard.
Definitely. And so how can people learn more about the program and the procedures too?
So the best way to learn is to look at our website at overlakehospital.org, and there's lots of information on how to access care for your specific condition, and that's the best way to do it.
Thank you so much for being here. This was really great and very timely for going into Heart Month.
Thank you, Kelly. Thank you for having me.
And to get in contact, like you just said, with Overlake Medical Center and learn more about what we discussed today, please visit the website that you see right there on your screen.
This portion of New Day Northwest is sponsored by Overlake Medical Center.